beautiful. We're talking about plastic surgery alternatives for the summer. We're with Dr. Elizabeth Lee. And first, let me remind you that we'll be taking your calls live with any questions you have for the doctor. The phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And our caveat, you always want to get a second opinion before you engage in any kind of plastic surgery. Let's go right to the phone lines. We have Shanmise from Richmond. Shanmise, I understand we're talking about non-surgical alternatives, but you have one that probably will involve some surgery. Good morning.
Good morning. How are you?
Great.
Good.
How are you?
Thanks.
I'm fine. Yeah, I mean, that's just my biggest flaw in myself is my breast. So I am thinking of getting plastic surgery, but I want to know what is the proper size for 34A.
It's interesting that people ask the proper size breasts. It's really so much a matter of personal choice. And when I have a patient in the office, one of the things that I do is give them instructions on how they can kind of fool around with different size implants to get an idea of how that feels in their clothes and how they feel when they look in the mirror, how it feels on their shoulders, so that I work pretty closely with patients to help them pick something that's right for them.
So literally, you wear it for a while?
Yeah.
Not the implant itself,
not the implant itself, but we have a little trick. Well, it's it's like a stuffer, but you're actually measuring how big you're using so that you know what feels good for you. And I help guide patients so that they're not going to do something that, in my opinion, is not going to look like what they're asking for, and hopefully that's something that's natural but just suits your body a little bit better.
Shanmise, are you still on the air with us?
I'm here.
Yeah. Does it matter, doctor, about height and frame and that sort of thing?
We're all different. I mean, you can always go big enough to be grotesque.
And we've seen all that on the internet.
We've seen all of that. But it really, there are people who are 5'2" and are very, very curvy and full, and there are people who are 5'2" who are like little twigs. And and it's really an issue of what feels comfortable to you.
So, Shanmise, what are you thinking?
I was thinking maybe not a big C, but a nice size C, because I'm 5'3".
Yeah.
I'm 130 pounds, so I think that would fit me. I didn't want to do nothing outrageous like a D, because I have watched shows where they said girls of a smaller bust shouldn't go over a certain size, should maybe go a cup or two up.
Right. Right. Well, I think that a 34C is probably a very nice size, but again, what that actually converts to and how you feel and how you look depends on what we work on together. So I'd be happy to work with you if you want to give the office a call.
Thanks, Shanmise. Hopefully we covered that topic for you. We also had Tamara from Vacaville. We just lost the call here, but she wants to know, she has stretch marks, and she wants to know if there's a way to treat them without laser.
Without laser. Right now, there's a new product on the market by a company, and it's called Mederma for stretch marks. Mederma is a company that's well known for over-the-counter things to treat scars. I've never been, a huge marketer or fan of the product, and there is Mederma for stretch marks. It's got some nice reviews, but I don't have personal experience with it. Without treating the laser, without treating with the laser, which actually is getting us some pretty good results with stretch marks in a pro-fractional approach. So where we do some, you have a little bit of healing time. We do a little bit more, in about a month, and it can take up to 6 treatments to get the maximum results. But the other thing is just surgical excision. So when we do a tummy tuck, most of those stretch marks come out.
I don't want to make this a statement of the profound obvious, but most people do know what stretch marks are because a lot of us get them if we've lost weight
from when we've grown quickly.
So they are actual scars, right? So it's maybe a bit of a misnomer. They're just under the skin scars?
They're under the skin scars, exactly. So people think about scars as being scars on the skin because you've had a cut. What a stretch mark actually is that the deep layer of skin called the dermis, which is where all your elasticity is, has actually torn, while the superficial layer or outer layer of the skin has remained intact. So what you're feeling is a scar in the deep layer while the surface is intact.
All right, so all that cocoa butter that I was putting on every summer.
Not likely.
No, cocoa butter won't work. No. So you're saying really the most success you've seen is with a laser
with the laser or with direct surgical excision. There's still, you know, nothing, but you certainly, the Mederma is not very expensive. It's over the counter. You can just go to your drugstore.
Okay.
I did want to say one more thing. You know, we're offering a little special today for the people watching the show, that for the first 15 callers who call to schedule and come in for a full, you know, aesthetic consultation, we're giving away a little bit of a gift with some Obagi product.
Very, very good. Okay, we got that. And of course, I don't want the callers who are on the line waiting to talk to you to hang up and then try to be the first 15. We need to take a quick break.
Okay.
But for more information about Dr. Lee, you can call our office at 510-704-2170 and find out more about that special offer. You can also check her out on the web at artfulsurgery.com. When we come back, we'll be talking more about alternatives to plastic surgery, and we'll be taking more of your phone calls live on the air.